Snapping hip. Also known as coxa saltans. Snapping hip is a condition characterized by a snapping sensation in the hip that comprises of three entities: external snapping hip, internal snapping hip, and intra-articular snapping hip. Causes of external snapping hip. Most common form: iliotibial tract sliding over greater trochanter. Causes of internal snapping hip: iliopsoas tendon sliding over. Femoral head. Prominent iliopectineal ridge. Intra-articular snapping hip. Caused by loose hip bodies. May be linked to synovial chondromatosis. Labral tears. Symptoms: snapping sensation in and around hip joint. May be painful or painless. Patient often able to reproduce snapping. Aggravated by activity. Clicking or locking sensation. More indicative of intra-articular pathology. Physical exam. External snapping hip is often visible while internal snapping is not, but may be audible. External snapping hip. Palpate greater trochanter as hip is actively flexed. Applying pressure will likely stop snapping, confirming diagnosis. Tightness of tensor fasciae lata diagnosed with Ober's test. Limited hip adduction when hip held in extension. Internal snapping hip. Snapping is reproduced by passively moving hip from a flexed and externally rotated position to an extended and internally rotated position. Physiotherapy management. For internal snapping hip syndrome. Address muscular flexibility and core strength deficits. A conservative treatment includes rest, stretching exercises, and hip strengthening. Iliopsoas stretching, concentric strengthening of the external and internal hip rotators, and eccentric strengthening of the hip flexors and extensors. Taylor and Clark, 1995, prescribed stretching and ultrasound to the femoral triangle. External coxa saltans treatment. Rest, NSAIDs, gentle stretching, strengthening exercises, hip abduction and hip external rotation, and icing. Increased stretching intensity to IT band may be initiated once initial inflammation subsides.